is Dr. Anja Karlstaedt. I'm an assistant professor at the Department of Cardiology at the Smith Heart Institute at Cedars-Sinai Medical Center, and I was a moderator at this morning's session on metabolic remodeling and cardiovascular diseases. I have the honor of speaking with Dr. Robert Weiss and with Omar Brito-Estada, who both presented two of their latest research studies. And I'm going to start with asking Dr. Robert Weiss to highlight some of his findings that he presented to the audience today on how energy metabolism is driving arrhythmias, and we would really like to know what are the clinical implications and also what were your main findings in this area.
Thank you. As many of you know, the heart has some of the highest energy requirements of any organ in the body, and some common cardiovascular conditions like heart failure impair energy metabolism, and that has consequences not just for the contractile function of the heart, but what we've been studying are whether it affects the electrical instability or arrhythmias, as well as remodeling or enlargement of the heart that sometimes occurs in heart failure. And so the studies that we pursued showed that demonstrated, perhaps for the first time, that enabling impaired myocardial metabolism can limit the expansion or dilatation of the failing heart. And also then we studied arrhythmias in patients, or at least the propensity for arrhythmias, which are really very hard to predict, especially those related to sudden cardiac death. We've developed some techniques to measure metabolism in the heart non-invasively with MRI techniques. And what we found are that hearts that have low ATP levels, which of course is the energetic gold of the heart, currency if you will, hearts that have low ATP levels were at an increased risk of developing sudden death or life-threatening arrhythmias over the next 5 to 10 years. And that was, I believe, although there had been evidence in animal hearts that impaired energy metabolism led to arrhythmias, I believe this is the first evidence in people that low energy metabolism could increase someone's risk of sudden cardiac death. You ask about what's the clinical significance of that. I think that most of our imaging techniques are related to assessing the structure and function of the heart, how well it works. And so I think it's kind of nice to now add to our armamentarium non-invasive imaging techniques that can measure myocardial metabolism. And then I think the second thing is there have been new classes of medications released in the last few years, often called metabolic modulators, like SGLT2 inhibitors and other classes. And it's interesting to note that perhaps that some of those metabolic strategies might actually not only improve the function of the heart, but our studies might suggest perhaps could affect the arrhythmia risk.
Oh, interesting. And can you use these technologies also to identify novel metabolic targets in addition to SGLT2 inhibitors? Do you think this development would drive the field forward clinically?
Well, I think more for the implementation. So we are measuring the chemical compounds, the fuels of the heart, the ATP and the creatine phosphate. We don't have the ability to measure every metabolic signaling molecule in the heart just yet. But I think like most things that we do in medicine, if we treat somebody's high blood pressure, we bring them back and we measure the blood pressure to see how they responded. I think it would be useful to have techniques if we're going to give medicines to affect metabolic metabolism, that we could then measure the metabolism after the intervention to see if they've adequately responded. So perhaps that would be a direction for the future as well.
In our session, we also had an early career investigator presenting his latest studies. Omar Brito-Estada from Dr. Kate McCarvich's lab at Cincinnati Children's Hospital. And so the title of your talk was very intriguing. It's called Dworf overexpression in the heart results in mitochondrial function. So can you tell us a little bit more about what Dworf actually is?
Yes, so Dworf is what we call a microprotein. So there's a novel class of proteins called microproteins that were previously overlooked, and Dworf is one of them. So Dworf stands for Dwarf Open Reading Frame. And Dworf actually has already been shown to enhance cardiac activity by enhancing the activity of CERCA, a calcium ATPase pump in the heart that drives relaxation and calcium uptake into the SR. And so right now we're actually looking at something else at Dworf, how it's cardioprotective And looking at the metabolism, that we see an enhanced function in the heart. And some of the new data that we have from my thesis project has shown that it's also located in the mitochondria as well. And so we're currently investigating what are some of the kind of mechanisms that kind of drive that cardioprotection in Dworf, as we want to develop Dworf as a heart failure therapeutic.
Thank you. And do you think that the role of mitochondrial dysfunction in cardiovascular diseases has also clinical relevance?
Yes, I believe so. So it is known that heart failure has severe metabolic dysfunction, and so since Dworf seems to enhance mitochondrial function, we think that it will have some clinical relevance going forward, and we're kind of investigating that. So we want to see if eventually we can translate this into heart failure, such as gene therapy approach, and kind of help enhance the metabolic dysfunction.
Thank you so much, Omar. And that concludes our morning session. We learned a lot about not only the role of metabolic adaptation in the heart during cardiovascular diseases, but also how we can use this knowledge and translating it into the clinic and hopefully develop therapeutic approaches and strategies for patients of arrhythmia and also heart failure. Thank you so much for your attention.